Okay, for this video, I was trying to decide on a name for it, either to call it Are You Dead Man Walking or How Hypertension and Diabetes Kill You. Okay, so here's a picture of the movie cover from Dead Man Walking. Sean Penn in the movie was the character who committed a terrible crime and he got the death penalty for it. She was one of the lawyer ladies trying to help him in the movie. Here is him walking on his way to the electric chair, and the other prisoners were saying out loud, "Dead man walking, dead man walking." And I'll explain just in a moment how that's relevant to our health discussion. So here he is, this final moment on the electric chair as he put himself there with his very, very, very bad behavior. Okay, and so now another metaphor to humans is that, your body is like a car, a Rolls Royce that God gives you, and it's supposed to last for a full 90 to 100 years. And usually it does if you take care of it. It potentially can, but you need it for your whole life, so you should definitely take better care of it than you do your car. And if the car says you got to put premium gas in there, you should put premium gas in there. You don't want to put regular gas if the car requires premium. Eating the wrong diet is like putting regular gas into a car that requires premium. Okay, and so then what the typical person does is they go to the doctor. But the problem is the doctor doesn't know almost anything about what causes disease or how to treat it. All the doctor knows is how to give drugs. So that's why jokingly I put this picture here from Dante's Divine Comedy of Dante with Virgil when once they get to the gates of hell, on the right above the door it says, "Abandon hope, all ye who enter." And that's what happens when you go to conventional medicine for treatment of chronic disease. They have no treatment. They're a joke. That's why they call it chronic, because they can't treat it. Okay, and then they'll start giving you drugs, and many of these drugs potentially make things worse. It's pretty routine that they're mitochondria inhibitors. They don't tell you to stop eating the fat, especially the sad fat that inhibits the mitochondria. They don't tell you to stop drinking the F- water that inhibits it. The atrazine, they don't tell you to eat organic. The atrazine and the GP that are sprayed on non-organic food. They often have people take Tylenol. They often give them statins for their cholesterol. They often give them metformin for their diabetes. All of these drugs interfere with mitochondrial function. Okay, not to mention they'll often tell them they have 1 or 2 drinks of alcohol a day that also interferes with mitochondrial function. Okay, so there's a whole bunch of them. They don't tell them to stop eating oils. Those interfere with mitochondrial function. Okay, so the patient's just getting worse. Now here's examples of problems that you want to know about that are common. Here's calcification of the left anterior descending coronary artery. Here's the left main coronary artery, the so-called widowmaker area. Here's where the circumflex originates, and then here's the left anterior descending traveling down the anterior surface of the left side of the heart, and that's a cardiac calcium CT. Here's a lumbar spine CT, and you can see the really low density black stuff here in the disc. That's gaseous disc degeneration from degenerative disc disease. These are bridging osteophytes trying to fuse across this degenerated segment. Here's an abdominal aorta with the white stuff being atherosclerotic calcifications, indicating atherosclerosis. That's probably going to narrow or occlude the lumbar arteries going to the spine. So what I'm showing you is how disease builds up and starts becoming irreversible. This narrowing of the disc space here at L4-5, that's irreversible disc degeneration. This is irreversible disc degeneration. The more this progresses, the more pain this patient will have from their spine. So this is a markedly degenerated spine. This is a patient who is likely having back pain and difficulty walking, potentially even in a walker at this point. But it could get worse than that before they need a walker. Here's a kidney. As you develop kidney failure, the kidney shrinks. So stage 1 with normal function, kidney's robust, but the more it fails, the more the kidney shrinks. And the same thing happens in the brain. All of this is going to make a lot of sense in a moment, but I got to give you the backstory knowledge so you can make sense of everything. Here's how the brain atrophies. Grade 0, the brain's uptight, a tight brain up against the inner table of the skull. The more atrophy you have, the more you see increase in the cerebrospinal fluid spaces of the brain sulci along the brain convexities, and a separation, the pulling away of the brain from the inner table of the skull. This is atrophy. So the more this brain atrophies, the higher risk the patient is to have dementia. Most of the patients I see with memory loss, cognitive decline, dementia, they just have an atrophic brain. I don't usually see any big strokes. I mean, I sometimes do, but I usually don't. I sometimes see quite a lot of periventricular abnormal signal, but a lot of times I don't. Most of the time I don't. Okay, now here's the car indicator lights, and when these go on, if you're smart, you pay attention to them. do whatever needs to be done to fix the car. You put some air in your tire, or you take it to somebody who knows how to fix it, and you get it fixed. Because if you don't, the car will tend to get worse. And here's the engine on fire. Now that's not good. Or overheated, it's a problem. So here is a kidney, and we were talking about hypertension, like hypertensive nephropathy or diabetic nephropathy. This is a normal side here, and this purple line is the glomerular basement membrane. So the blood comes in through the efferent arteriole and this red stuff here, and then it's going to go through these individual capillaries. We're now seeing them in cross-section. This is in the longitudinal section. Okay, so this purple line that sort of outlines the capillaries as they pass through the glomerulus, the filtration part of the kidney, is normally rather thin like we see here, but it becomes thickened with diabetes. That's called glomerular basement membrane, GBM thickening. Okay, and that's bad. There'll be problems with that membrane as diabetes progresses. It's called diabetic nephropathy, and you're going to start leaking protein into the urine. This is called albuminuria. The protein in the blood is called albumin, so urea for urine. So albuminuria means you're leaking excessive amounts of this green stuff into your urine. That's bad. Once this happens, the patient will often have irreversible worsening of kidney failure until they progress to dialysis. Half of dialysis patients are dead in 5 or fewer years, so it's not good and they don't feel good. Okay, I just want to show you an article because this tells you how stuff works, and I'm also trying to explain why do I sort of feel so sorry for these patients and think they're kind of pathetic disaster. Okay, so the name of the article is Rethinking Glomerular Basement Membrane Thickening and Diabetic Nephropathy. Okay, diabetic nephropathy is the most common cause of kidney failure, chronic kidney disease in the United States. It is also a major cause of cardiovascular disease and death. It occurs insidiously, meaning kind of gradually, sneakily, asymptomatic over years before you start having irreversible changes with a loss of GFR, ability of the kidney to filter, glomerular filtration rate, and you start leaking albumin into the urine. Micro means small amount of albumin, the protein, urea in the urine, microalbuminuria. Okay, once microalbuminuria is clinically present, structural lesions are usually quite advanced, and GFR decline may then proceed rapidly towards end-stage kidney disease. End-stage kidney disease means you're on dialysis, which is bad. 5 hours a day, 3 days a week, it's a nightmare. Okay, so here's the key paragraph. This is why I made this talk, because this paragraph is so extraordinary. You don't usually see this extraordinary and clear of a paragraph in scientific journals. It says, a natural history of diabetes, both type 1 and type 2, begins with an initially long, clinically silent period. The patients remain normal albuminuric, meaning they don't leak protein into the urine typically, and they can initially maintain a normal GFR. However, here's the key phrase, however, during this clinically silent phase, structural lesions develop, including glomerular basement membrane thickening, GBM thickening, mesangial expansion, that's the connective soft tissue between the capillaries of the glomerulus, and glomerular sclerosis, fibrosis of the glomerulus, the filtration system of the kidney, meaning you're going into kidney failure. Once microalbuminuria is clinically apparent, the structural lesions are often quite advanced. So what they're saying is, by the time you can detect that there's a problem in the kidney, you already often have rather severe kidney damage. And then GFR decline, glomerular filtration decline, the ability of the kidney to filter, may proceed rapidly towards end-stage renal failure, ESRD. Indeed, treatment initiated after the onset of overt diabetic nephropathy, it typically cannot arrest progression. That's what I meant by you better pay attention to early warning lights, because otherwise you're going to end up screwed with the engine on fire, and it might not be so easy to fix. And that's what I meant by also dead man walking. I see all these patients like every day, and it's like, oh, my diabetes is under control, my hypertension is under control. You know, they're on all these different pills, and they're usually really not under good control, and they're progressing towards irreversible disease. And by the way, there is such a thing as a low or even a very low protein diet, sometimes requiring, well, I'm not going to go into the details of essential amino acids and not, but by dramatically lowering the protein of the diet and switching to a plant-based diet, so you decrease the acid load, you increase the vasodilators in there, the potassium, the magnesium, and the plant nitrates, you can improve blood flow to the kidney and decrease its workload, and you might be able to slow down kidney failure. Most doctors don't know that. Even most kidney doctors don't know that. But anyways, what I was trying to show you is the typical patient is basically destroying themselves. You try to give them advice and they'll say, oh, well, I'm working on it, I'm trying to cut down on meat, I'm cutting down on salt. And what I'm saying is if you have a brain in your head, you realize this is serious stuff. And if you don't get your act together, you could have irreversible disease that makes you very sick, cognitively impaired, and you die prematurely and your body doesn't work so well and you end up sick and sad. So anyways, that's the point, that irreversible disease is happening when you got these warning lights on, like an abnormal fasting blood glucose or an abnormal hemoglobin A1C, and you should take them super seriously and fix them by improving your diet and lifestyle, especially diet, while these are easy to fix and they're completely reversible, because later on, when you start leaking significant amounts of protein in your urine, that could be irreversible disaster. So anyways, kind of like, one last thing, kind of like that lady said, Lorraine, Dr. Day, she said that it's okay to scare people when you teach them. She says you have to scare them a little bit when you're talking about this health and nutrition stuff, because happy people will not change their diet and habits. They need to be a little scared so they're motivated to change and get their act together.